Welcome back to our channel. Today, we're answering a common question. Does drinking coffee affect your blood pressure? Coffee is a beloved beverage, but if you're concerned about your cardiovascular health, you might wonder how it impacts your blood pressure. Stay tuned as we dive into the science behind caffeine, how it affects your body, and what you can do to enjoy your coffee safely. Drinking coffee is a daily ritual for millions of people around the world. Whether it's to kickstart the morning or to enjoy a midday pick-me-up, coffee is loved for its rich flavor and stimulating effect. But if you're someone who has high blood pressure or is concerned about your cardiovascular health, you might be wondering whether drinking coffee can affect your blood pressure. This is an important question because blood pressure management is crucial for maintaining overall heart health and reducing the risk of serious health problems, such as stroke and heart attack. The relationship between coffee and blood pressure is complex, and understanding how caffeine affects the body can help you make informed decisions about your coffee consumption. Caffeine, the primary active ingredient in coffee, is a stimulant that affects the central nervous system. When you consume caffeine, it triggers the release of adrenaline, which can cause a temporary increase in heart rate and blood pressure. For some people, this rise in blood pressure can occur within 30 minutes of drinking coffee and may last for a few hours. The degree of the increase can vary depending on individual factors, including your sensitivity to caffeine, your usual caffeine intake, and your overall health. If you are particularly sensitive to caffeine, you might notice a more pronounced spike in blood pressure after drinking coffee, even if you don't normally have issues with high blood pressure. For many people, the rise in blood pressure after drinking coffee is temporary and not a cause for concern. However, if you have hypertension or are at risk for cardiovascular disease, these temporary spikes in blood pressure could potentially have negative effects over time. Even small, temporary increases in blood pressure can strain your arteries and heart, especially if they occur frequently throughout the day. This is why some healthcare professionals recommend that people with high blood pressure limit their caffeine intake, including coffee, or monitor their blood pressure closely to see how it responds to caffeine. Interestingly, not everyone experiences the same blood pressure-raising effects from drinking coffee. Regular coffee drinkers, for example, might develop a tolerance to caffeine over time. When this happens, the body becomes accustomed to the presence of caffeine, and the blood pressure spikes that were once noticeable may become less significant or even non-existent. This is why some long-term coffee drinkers can consume several cups of coffee a day without experiencing any noticeable changes in their blood pressure. However, developing a tolerance doesn't mean that caffeine is no longer affecting your cardiovascular system. It's still important to be mindful of your overall caffeine intake and how it might be impacting your health, even if you don't notice immediate changes in your blood pressure. There is also research that suggests that the long-term effects of coffee consumption on blood pressure may not be as harmful as once thought. Some studies have found that habitual coffee consumption is not strongly associated with an increased risk of hypertension in healthy adults. In fact, some research suggests that regular coffee drinkers may actually have a lower risk of developing cardiovascular disease compared to those who don't drink coffee. This may be due to the presence of antioxidants and other beneficial compounds in coffee that can support heart health. However, this does not mean that coffee is completely safe for everyone. Individual factors such as genetics, overall diet, and lifestyle habits can influence how coffee affects your health. So it's important to consider your own situation when deciding how much coffee to drink. If you're someone who loves coffee but is concerned about how it might be affecting your blood pressure, there are a few things you can do to enjoy your coffee while minimizing potential risks. First, pay attention to your body's response to caffeine. If you notice that your heart rate increases, or you feel jittery or anxious after drinking coffee, it may be a sign that you're sensitive to caffeine and should consider reducing your intake. You can also try switching to decaffeinated coffee, or limiting your coffee consumption to earlier in the day to prevent any potential negative effects on your sleep or blood pressure. Monitoring your blood pressure at home can also be helpful. as it allows you to see how your body responds to coffee and make adjustments as needed. It's also worth noting that not all caffeinated beverages have the same effects on blood pressure. For example, energy drinks and certain sodas can contain much higher levels of caffeine than coffee, as well as added sugars and other ingredients that can negatively impact cardiovascular health. If you're concerned about your blood pressure, it's important to be mindful of all sources of caffeine in your diet, not just coffee. Ultimately, if you have high blood pressure or are at risk for heart problems, it's always a good idea to talk to your healthcare provider about your coffee consumption. They can help you understand how caffeine might be affecting your blood pressure and provide personalized recommendations based on your health needs. While coffee can be a part of a healthy lifestyle for many people, it's important to approach it with mindfulness, especially if you have underlying health concerns.